It is with great privilege that I introduce our next speaker. He is one to tell you to keep your mouth shut, not because he doesn't want to hear what you have to say, but because it can change your whole life. I'm very excited to welcome Patrick McKeown today. Patrick's interest in breast training began when, at the age of 26, and after a lifetime of asthma medication and inhalers, he discovered the WHA breathing method. He's been teaching breathing techniques since 2002 and is a leading international expert on breathing and sleep. Not only has he authored best-selling books, but lectures around the world and is Director of Education at the world's foremost WHA breathing method clinic. So without further ado, I'd like to hand it over to Patrick. Welcome, Patrick.
Thanks very much. It's good to be here, Erin.
Great. So Patrick's hiding out in Ireland. We can tell that by the accent. I have been recently reading some of Patrick's books, The Breathing Cure and Oxygen Advantage, and have found them hugely fascinating. And as I said, it's a huge privilege to have Patrick with us today to hear more about breathing and how it really can change your life.
Yeah, I suppose when it comes to breathing, a lot of people think about breathing as take that deep breath. You know, the normal instruction you hear down in the local yoga studio, in through your nose, out through your mouth, maybe pursed lip breathing, full big breaths. And that's only touching one aspect of breathing. Really, when it comes about people with respiratory complaints, we want to help bring some control to their breath. And we can do that irrespective of the state of their breathing pattern. So for example, if you have somebody coming in with severe asthma, they will typically be breathing a little bit faster. They're breathing shallow. They often have air hunger. They're feeling that they're not getting enough air. We don't teach slow breathing to this group. We give them small breath holds. And we give them small breath holds to help to bring breathing recovery, but also to harness the gas nitric oxide that's antiviral and that's produced inside in the paranasal sinuses. But we also help them to stimulate the vagus nerve to bring the autonomic nervous system into balance, because the inflammation of the lungs is going to be made worse by stress. So the other aspect of this is that people with asthma and respiratory complaints, they don't just have asthma, but they're also more likely to be tired. And as asthma severity increases, so does sleep disorder breathing. So my background is trying to bring scientifically based techniques into the realm of respiratory health, but also sleep and anxiety and panic disorder. And ultimately, they are all connected. The person with breathing issues who is breathing that little bit faster and harder, that's also going to cause a stress response. And their stress response is feeding into the condition. I think, Erin, that's also the connection as well with asthma. You know, if we have inflammation of the lungs, it's not just isolated to the lungs, but it will travel up to the nose. The nose is more stuffy. As a result, we might breathe. Taking cold, dry, unfiltered air directly into the lungs is going to trigger inflammation. And the premise of that is it's taught that when you're taking cold, dry air into your lungs, moisture is sucked out of the airways and there's a cooling effect on the airway walls, which triggers inflammation. And that's why doctors often recommended swimming, because when you were swimming, you were inhaling moist air, or the old wives' tale or trick was to breathe in and out of, you know, you would have a basin of water with hot water and you're breathing in and out of that. But ultimately, for me, any person coming in with respiratory issues, the first thing, first and foremost, is to breathe in and out through the nose. And it's the most undervalued organ in the human body. And I cannot believe to this day why people with respiratory complaints are not advised to breathe in and out through their nose. Number one is the mouth does nothing for breathing. You know, if you were to ask any medical doctor, any pulmonologist, respiratory consultant, or read any medical textbook, what parts of the mouth are devoted exclusively to the breath? What does the mouth do when it comes to breathing? And the answer is nothing. The mouth is a hole, if I'm to be crude about it, and air comes straight into your mouth, down your throat, and into your lungs. The mouth does zero, and the nose does all the work. So if we think of it this way, I often get my students to look down at their chest and to take the breath through the mouth. So if you look down at your chest and you take the breath through the mouth, you will typically see that mouth breathing is engaging more of the upper chest. And we know in the human lungs that the greatest concentration of blood flow is in the lower lobes of the lungs. So by breathing through your nose, you typically can take the air into the lower regions. And it's known since 1988 by a New Zealand doctor, by the way, and I would say one of the foremost ENTs, that at least here is an ear, nose and throat doctor who considers the nose to be an important organ. His name is Dr. James Bartley. I'm not sure if you're putting out this podcast in visual, but I'm going to pull up a chapter from a medical textbook, and let's start looking at what the nose does. And the reason we need to do this is because it's very common for people with respiratory complaints to breathe through an open mouth. Not always. You know, during rest, they may have the mouth open from time to time. During sleep, it's very common for them to wake up with a dry mouth, and doing physical exercise. So this was a textbook. This is a chapter that was in the textbook published back in 2013. And the textbook is nasal physiology and pathophysiology of nasal disorders. And when you scroll down here, you're looking at, in a study of arterial oxygen levels, the PaO2, so the partial pressure of oxygen in the arterial blood, before and after jaw wiring, which forced patients continuously to breathe through their noses. The partial pressure of oxygen in the blood increased by nearly 10%. Now, surely with somebody with respiratory complaints, we should be teaching them the importance of nasal breathing to improve gas exchange. And furthermore, nasal packing after nasal surgery, so when patients have had nasal operation and then their nose is packed, this in turn is causing a reduction of blood oxygen saturation. So mouth breathing, as I said, plays absolutely no role other than an emergency. And we have to consider in the human lungs that the nose occupies quite an amount of space in the skulls. And very often what I say to my own students is to run your tongue along the roof of the mouth, right until you feel the soft palate at the back. And the roof of the mouth is the floor of the nose. Say, for example, here's the nose that you have in your face, and here you have the nasal cavity, and then you have the hard palate, and you have the soft palate, and then you have your throat here. So you can imagine then, as we're taking air in through the nose, where the nose is moistening the incoming air, the nose is regulating volume, the nose is harnessing the gas nasal nitric oxide. Nitric oxide was first discovered in 1991 in the exhaled breath. So your nose is warming the incoming air. It's moistening the incoming air. It's filtering the airflow, because many people with asthma and breathing issues, they are triggered by different airborne particles, dust mites, animal dander, pollen pollutants, etc. But our nose is the only organ that helps to filter the incoming air coming in. Your nose helps to regulate volume. And your nose also, by slowing down the breath, helps to maintain more normal blood gases. And I'm talking not just about oxygen, but I'm also talking about carbon dioxide. Now, carbon dioxide is also a natural bronchodilator. But for example, if we have a stuffy nose, which is very common with asthma, we feel uncomfortable breathing through the nose, so we switch to mouth breathing. But mouth breathing is fast breathing, and mouth breathing is shallow breathing. And fast and shallow breathing feeds into an increased stress response. And fast and shallow breathing also increases the risk of sleep issues. So myself as an asthmatic, switching from mouth to nose breathing, it made an enormous difference. And the strange thing about this was I went to medical doctors every 3 months for about 20 years, looking for repeat prescriptions for medication. And no medical doctor ever encouraged me to breathe through the nose. It's affected my teeth, my gums. I have more dental cavities than your normal mouth breather, than your normal nasal breather will have. The shape of my face, my jaws are set back, my airways are compromised, I have a high palate. All of these things that are characteristic of having the mouth open. My sleep was impacted, my concentration in school. I got through my grades, but I had to work really, really hard with it. And it could have been a lot easier. You know, so that's the first thing I'll talk about, the importance of nose breathing. The second thing is, I never realized back then that when I first came across breathing exercises, about the importance of breathing light. Now I'm going to show you an interesting, and this was published by the this was the Mater Hospital trial in Brisbane in 1998. And it was published in the American Journal of Australia. in 1998. The trial actually took place in 1994. I'm going to put it up on screen here. Very often we feel that with breathing, the more air we breathe, the better. But in actual fact, that's not correct. And there is a normal volume of air to breathe. So this is the Mater Hospital Buteyko trial, the first one that was outside of Russia. And just to emphasize that Dr. Buteyko was a Ukrainian doctor. And I think that's very important just to emphasize in today's climate. But if we look at the minute ventilation here, I'm going to scroll down to minute volume, because normal minute volume in the normal population is about 4 to 6 liters per minute, or 4 to 7 liters per minute. Whereas the Buteyko group and the control group were breathing 14 liters of air per minute. They were breathing 2 times more than normal. Now, if you're breathing 2 times more than normal, that's going to have implications on the lungs. And carbon dioxide here is a little bit too low, 33.2 millimeters of mercury in the Buteyko group and 32 in the control group. This is an interesting study because the control group did the in-house hospital program in Brisbane. And it was over 4 months. So it was 12 weeks. 3 months actually, 12 weeks. And if we look at the result here, by those that were practicing the Buteyko breathing method, their inhaled corticosteroid reduced by 49% at 3 months follow-up. And there was 0% change in the control group. The group who were practicing breathing exercises as taught in the Mater Hospital in Brisbane had 0% change. Now, this has been replicated, I would say 20 times. So this isn't just a once-off. The lung function didn't change, but we have to bear in mind that people had the same lung function, the same forced expiratory volume as that they had, but with 49% less need for steroid. They had also 90% less need for bronchodilator medication. Now, so you can imagine that students and clients going into halotherapy. And of course, the benefits of salt inhalation has been known for a long, long time. In a month or two, I go to Poland and I give my trainings there. I actually give trainings in Poland tomorrow for the next 4 days, but I go to Krakow and we will be making a trip down to the salt mines. So we know of these benefits and we know what salt can do to the lungs. But think of students going into the halotherapy and having breathing exercises while they're in there and the benefits that that might bring. So what I'm going to do is bring you through a few different breathing exercises. We're going to start off with a very gentle breathing exercise that we could use with all people with asthma and breathing problems, even with COPD, regardless of severity. And this is an exercise to help bring just a calmness to labored breathing. So ultimately, our objective is to normalize minute volume. We're recognizing that people with asthma can breathe too hard and too fast and often through the mouth, upper chest breathing, and this is causing a cooling and drying of the airways. Now, this, of course, is not new. I'm going to pull up a paper that was published back in 2002, and the name of the paper is called Hypocapnia. It was written by 2 anesthetists, Dr. Laffey and Dr. Kavanagh. And hypocapnia means low carbon dioxide. And I'm not going to say that carbon dioxide is the full picture with asthma. It's not. It's one of those things. And I'm scrolling down to a very interesting diagram that they show how the breathing patterns with asthma feeds into the condition. So you can imagine the person with asthma, they have airway narrowing. It's not the most comfortable. You're feeling that you're not getting enough air. And because you're feeling that you're not getting enough air, the natural response is to breathe harder and faster. So you breathe harder and faster, you've got an increased sensation of breathlessness, and this is feeding into hyperventilation. Hyperventilation then is feeding into airway hypocapnia, low CO2, and this is going to cause airways to constrict. But it's not just that hyperventilation is feeding into airway hypocapnia. Hyperventilation can also cause cooling of the airway walls. It can cause drying of the airway walls. And because these individuals are feeling suffocated or they're feeling that they're not getting enough air breathing through their nose, they switch to mouth breathing. So they are bypassing the effects of nasal nitric oxide. They're also taking more inhaled particles into their lungs. So a combination of cooling and drying and mouth breathing and unregulated breathing, unfiltered air coming into the lungs, is causing smooth muscle in the airways to constrict, increased amounts of mucus, and you can also argue inflammation here because of the cooling and drying effect. And this is causing increased airway resistance, so it's more difficult to breathe, which increases the work of breathing. We've got an increased sensation of air hunger, which is feeding into hyperventilation. So hyperventilation and breathing pattern disorders is relatively common in people with asthma. The literature shows about 30%, but I would say it's much more, having worked with thousands of people with asthma. In actual fact, my first 6-7 years was only with people with asthma. So coming back to this little gentle breath hold time. So this is when one has breathing that's a little bit labored or a little bit uncomfortable and you want to try and bring control to it. You could also use this exercise as an exercise to help alleviate coughing or even chest tightness or wheezing. And of course, we're using this as an adjunct to conventional medication and also to halotherapy. But it's a simple little tool that you can use. So the exercise goes as follows. Take a normal breath in and out through your nose and pinch your nose and hold your breath and hold for 5, 4, 3, 2, 1. Let go, breathe in through your nose. And now you're just breathing normal for about 2 to 3 breaths or 10 to 15 seconds. And again, take a normal breath in through your nose and out through your nose and pinch your nose and hold 5, 4, 3, 2, 1. Let go, breathe in through your nose. And you're breathing normally for about 2 to 3 breaths or 10 to 15 seconds. And again, take a normal breath in through your nose and out through your nose and pinch your nose and hold 5, 4, 3, 2, 1. Let go, breathe in through your nose and breathe normally for 2 to 3 breaths. Now, as you breathe in and out and you hold your nose, nitric oxide pools inside the nasal airway. So when you let go of your nose, you're carrying this nitric oxide into your lungs. And nitric oxide is antiviral as well. And it's a bronchodilator. And it's helping to redistribute the blood throughout the lungs. And again, take a normal breath in through your nose and out through your nose and pinch your nose and hold 5, 4, 3, 2, 1. Let go, breathe in through your nose and to breathe normally for 10 to 15 seconds or 2 to 3 breaths. Now, for some people, the 5-second breath hold might be too much. Instead, you could hold your breath for 2 seconds or 3 seconds. So with people with long COVID, we often see very dysregulated breathing. So we start very gently because we don't want to do a breath hold that's going to cause the person to lose control of their breathing. And again, take a normal breath in through your nose and out through your nose and pinch your nose and hold 5, 4, 3, 2, 1. Let go, breathe in through the nose. And you're breathing normally for 2 to 3 breaths. And again, take a normal breath in through your nose and out through your nose and pinch your nose and hold 5, 4, 3, 2, 1. Let go, breathe in through the nose and breathe normally for 2 to 3 breaths. So that's an exercise that people can practice if their breathing is quite poorly. And if they have, say, for example, coughing or wheezing or a little bit of chest tightness there, it can bring them relief. The next exercise that we do to help open up the nose is a longer breath hold. And the reason being is because when you have inflammation of the lungs, that inflammation will often travel up to the nose. And since 2007, actually, researchers have talked about a unified airway, that the nose is not distinct or in isolation to the lungs. So coming back to Dr. James Bartley's paper here, and you'll see it, he's talking about nasal breathing improves arterial oxygen concentrations and carbon dioxide excretion. Nasal mucosal inflammation results in lower airway inflammation and vice versa. They are linked. Many patients with asthma, COPD and bronchiectasis have significant upper respiratory disease. Nitric oxide from the nose and sinuses may have a role in the sterilization of incoming air and improving ventilation perfusion. And another aspect of this is when you do physical exercise with your mouth closed, the fraction of expired oxygen is less. And that's an Australian study by Morton in 1995. that, in other words, when you do go for a walk with your mouth closed, you have all of those benefits and less of a reduce of exercise-induced bronchoconstriction, but also your body is able to utilize oxygen better. So the exercise to decongest the nose will go as follows. Now, don't do this if you're pregnant or if you've got any serious medical conditions. And if you have anxiety or panic disorder, go easy. Yeah, so, but to decongest the nose, take a normal breath in through your nose and out through your nose, and pinch your nose and hold your nose, and just gently nod your head up and down as you hold your breath. And you continue gently nodding your head up and down as you hold your breath. And continue until you have a moderate to strong air hunger, but then let go. So you could even let go there. So do a couple of easy ones. So it's known since 1923 that when you do a breath hold, it helps to decongest the nose. Now, the other aspect of this is that the more you breathe through your nose, the better it works. So say, for example, if you have any students who are going into halotherapy and they're getting the benefits of it, but if they are leaving the clinic with their mouth open, in other words, my point here is that if they understand to leave the clinic with their mouth closed and breathe through their nose and bring nasal breathing into their everyday life, and if their nose gets congested outside of the clinic, they can gently open it up. And this will add and improve their benefits as well. So again, take a normal breath in through your nose and out through your nose, and pinch your nose and hold your nose, and just gently nod your head up and down as you hold your breath. So you're just gently nodding your head up and down as you hold your breath. And you continue holding your breath until you feel a moderate to strong air hunger. There's no need to overdo it, but to hold your breath until you feel kind of a moderate to strong air hunger, and then to let go, but to breathe in through your nose. And it's not known exactly how this exercise works, but it may work by invoking a stress response. And that can be also because of the increase of carbon dioxide in the blood. And so when the nose is stuffy, practice that exercise 5 or 6 times, and it will help to bring relief. So it's the blood vessels in the nose which have swelled up that you can help to bring some constriction to them by simply holding your breath. The next exercise that I'm going to do is actually a breathe light exercise to help normalize minute ventilation. So with this exercise, I would like you to put one hand on your chest and one hand just above your navel, and to tune into your breathing patterns, to feel the slightly colder air coming into your nose and the slightly warmer air as it leaves your nose, and to feel the slightly colder air coming in and the slightly warmer air leaving. And as you're breathing, it's just to gently soften and slow down the speed of your breathing. So there's your breath coming in and there's your breath leaving. And just gently soften. There's your breath coming in and there's your breath leaving there. So slow down your breathing to the point that you feel that there's not quite enough air. And you don't want to have it uncomfortable. It can be a little bit uncomfortable, but you don't want to have it stressful. And what we're doing here is we're gently softening and slowing down the speed of the air as it enters and leaves the nostrils. And the objective here is to gently reduce the volume of air that you are breathing to increase carbon dioxide in the blood, because carbon dioxide in the blood, as it increases, will help to open up the airways. And also, as you're breathing very softly and slowly through your nose, you're picking up and harnessing nasal nitric oxide. So as you're breathing so slowly through your nose, you've got nitric oxide laden air coming into your lungs, and nitric oxide is also helping to open up the airways. So that can be a very useful tool, but it can also be a very useful tool to help activate the body's relaxation response. For me, it is very normal for children and adults with asthma, because of resultant nasal obstruction, to mouth breathe. Mouth breathing is causing faster and shallow breathing. Fast and shallow breathing evokes a stress response, and a stress response can feed back into their asthma. So we want to help to bring balance to the autonomic nervous system and to improve vagal tone. And we can do that by breathing light, but also by breathing slow and by breathing low. So the slow breath then would be always working to have that slow and relaxed exhalation, and especially teaching people with asthma, but also with anxiety and panic disorder, strategies of how to breathe when you get stressed. So you can imagine that a difficult situation arises. And the person responds by breathing faster and shallow. But fast and shallow breathing then is feeding into the stress response. So instead, I would like students to be, whenever there is a difficult situation, and start off with small situations, take that soft breath in through the nose and a really slow and relaxed and gentle breath out. Because whenever you have that slow and relaxed and gentle breath out, you stimulate the vagus nerve, which secretes a neurotransmitter called acetylcholine, which causes a slowing of the heart, which evokes the body's relaxation response. And then we focus on breathing exercise then to have better recruitment of the diaphragm. So I suppose ultimately, Aaron, I know I'm talking a lot here, but ultimately it's about recognizing that, yes, people with respiratory problems, it can affect their breathing patterns. And then they develop a habit of suboptimal breathing patterns, which feeds back into the respiratory problems. And first and foremost, nose breathing versus mouth breathing. I have never came across a paper yet that said it's better for somebody with asthma and respiratory issues to breathe through their mouth versus breathing through the nose. I have never come across that paper. It's a very understudied area, unfortunately, but it comes back to the basic premise. What does your nose do that your mouth doesn't? Your mouth does nothing, and your nose does everything when it comes to the breath.
It totally makes sense. I know a few years back, someone told me nose is for breathing, mouth is for eating. And yes. I've always kind of tried to bear that in mind, but until I actually read your book and understood the science behind it and tried some of the exercises, I hadn't really fully appreciated just how important that was. And for me, since reading your books, I am now constantly going around looking at people. Oh, that's the mouth breather, that's the nose breather, mouth breather. And when people come into my salt room, I do have that discussion with them now after, finding out what their issues are, what they're struggling with. And the first thing I talk to them about is breathing. And then I do give them some of your breathing exercises to try in the salt room while they're in there. Generally that short 5-second one is good. But I also see people who want to improve sports performance. And so then we'll talk about the BOLT score, which is discussed in more detail in your book. I've now kind of got up to about 40 seconds, so I'm quite happy.
Well done. That's super. That's great.
I was even walking on my walk this morning with my dog and doing my whole nose breathing and holding my breath as I was going along. And it's incredible what difference it makes to a lot of things. And I noticed that my children, even one son definitely breathes more through his mouth. And so we've started practicing nose breathing sessions together as well. And it is about 5 or 6 cycles that really starts to unblock the nose. And this is in between kind of halotherapy sessions, because we also find that, with the halotherapy, whether it's anti-inflammatory and decongesting, that really works while people are in the room. But having these tools to enhance it and practice in between is kind of like an added bonus. So yeah, it's very, very fascinating.
It is. And it's also just for people to realize that, it just doesn't make sense to leave the halotherapy clinic with your mouth open and to sleep with your mouth open. And for me, once you switch to mouth breathing, you're going to undo some of the benefits anyway. If we're getting the nose working right, why not use it? Why switch to mouth breathing following it? And yeah, I think because it's going beyond, like even if Dr. Morris Cottle said the nose is responsible for 30 functions in the human body, 30 functions. And even people with, to give you an example, 75% of people with anxiety and panic disorder have dysfunctional breathing, 75%, 50% of people with lower back pain. I said the asthma population is about 30%, although I believe it to be much higher in practice and observation. So you've got a group and a cohort of patients and clients that their breathing is letting them down.
And as you kind of touched on it about people who can't breathe well or are struggling to breathe, their levels of anxiety go up. And I guess it's also similar for maybe going into situations where you might be claustrophobic and things like that. And to start to focus on your breathing can really help reduce that anxiety level.
Yes.
But one question I have, there's always been that myth of when you yawn, or I don't know whether it's a myth or I just remember being told as a child that when you yawn, it's because there's not enough oxygen. How does
Yeah,
that
it's
stack up?
kind of an unusual one, because if we were to measure blood oxygen saturation across any person, typically with a person with okay breathing, it's going to be between 95 to 99%. And yawning and frequent sighing is something that we do see with people with suboptimal breathing patterns. And we're not quite sure why we yawn. I don't think anybody knows really why we yawn. And you know, it's quite contagious as well. Like the very fact that we're talking about it, it can often set off yawning. And
Yeah.
it is true, when we're tired, we yawn more, but also when we evoke a relaxation response, we tend to yawn more. So when we do the light breathing that we spoke about earlier on, and you're taking that soft breath in, the really relaxed and slow, gentle breath out, carbon dioxide increases in the blood, but also that really relaxed, slow, gentle breath out. Your body is telling the brain that everything is okay. And that evokes a rest and digest response, and you will have increased watery saliva in the mouth, and you're feeling sleepy and you yawn. But other than that, yawning is it's one of those things that's not so much is known about.
Yeah. We're talking about sleep then. You know, we see that people are really struggling to sleep. It's getting more prevalent. The insomnia, sleep apnea, snoring, mouth breathing, all of that.
Yeah.
And obviously by trying these techniques and combining with halotherapy, it creates kind of the perfect harmony and to induce sleep, because with the halotherapy, we have the negative ions in the room, which helps to de-stress, reduce anxiety. We've got the anti-inflammatory properties. And then you add the breathing in as well to further enhance that. But I also noticed that when you are trying to go to sleep and you're struggling to sleep, that focusing on your breathing and counting your breathing or whatever, all of a sudden you can't start thinking about all those other things. So it's kind of a bit of a mind over matter, but seems to induce a nicer sleep as well.
Well, there's no doubt about it. If we've had a bad day, and every now and again we're going to have a bad day, and it's not easy always to switch off the mind. Now it becomes easier with practice, and it also becomes easier if we have some connection that we can fall back on breathing. Not everybody with anxiety and panic disorder can focus on breathing, because the very act of focusing on their breathing can make them anxious. But they could do small breath holds, because you can do breathing techniques without having to focus on your breathing. So for insomnia, then it's all about down regulating before sleep. And we down regulate by slowing down our breathing patterns. Now there's other things as well, in terms of sleep hygiene, not to be looking at blue light, and the bedroom should be dark, and the bedroom should be airy. The temperature of the bed should be cool. If you're overly hot, it'll cause your breathing to be faster and harder. It can arouse you from sleep. Snoring, there's two forms of snoring. One is snoring through the mouth, which goes like this. But if once you get your mouth closed, your mouth snoring stops. So we've used tape for about 20 years now, even before that. And more recently, we've used our own tape, which is myotape. And the difference is it surrounds the mouth without covering the lips. So we have a tape that surrounds the mouth with elastic tension and pulls the lips together. So we developed it for kids originally, and then it became popular with adults. Now, the other aspect then is sleep apnea. I wrote a paper with two ear, nose and throat doctors, Dr. Carlos O'Connor, who's an ENT, and Dr. Guillermo Plaza, and it was published in the Journal of Clinical Medicine, which is peer reviewed. And it's looking at the application of functional breathing during the day to the phenotypes of obstructive sleep apnea. Now, sleep apnea is relatively common in the asthma population. And as asthma severity increases, so does sleep. And that's why when people come into me with asthma, I'm saying, listen, we don't just have asthma. We're tired. We're tired. So what do we want to achieve when we're restoring breathing patterns? We want to establish full-time nasal breathing during wakefulness and sleep, and also to have the tongue resting up in the roof of the mouth so that it's not likely to be encroaching the airway. We want to slow down the respiratory rate, and we use the BOLT score, the breath hold time, to establish chemosensitivity to carbon dioxide. We want to restore diaphragm function with lateral expansion and contraction of the lower ribs, and normalizing minute volume. So for breathing patterns, it's very important to think of breathing as across three different dimensions. You've got the biochemical dimension, the biomechanical dimension, but also in terms of the autonomic nervous system, because people with obstructive sleep apnea typically have a reduced heart rate variability, which implies that they're in a more stress response. So it's very important to bring regulation there, to bring balance. And that's what this paper here, I supported with 160 different references. And we're looking at the phenotypes and different characteristics of sleep apnea and how your breathing patterns during the day are going to influence that. So I think there's a huge realm. You know, your people coming into your clinics, they don't just have respiratory issues. As you said, you know, anxiety and panic can be a feature there. Of course it is. If you have a breathing problem, it's not a nice feeling. And that feeling of suffocation and air hunger, it'll often feed into that stress response. And then you have a sleep problem thrown in there, and that's going to also feed into a stress response.
Totally. And it's also amazing how sleep can affect someone's day. And if you don't get enough of it, then you're cranky. But
Yes.
Please don't go sticking duct tape onto your other half's mouth at night time.
Yes, absolutely.
I believe you can purchase the special tape from, is it the Oxygen Advantage or your website?
Yes, it's in the websites. It's on Amazon. It's on myotape.com as well.
Yeah, just need to put that caveat in about the duct
Sure,
tape.
just in case. Who knows?
Yeah. Now I know we're on a bit of a time limit, but I just have one more query, and that's kind of around COVID. Obviously, coming out of the pandemic, we've had respiratory conditions and all sorts being exacerbated. But I was interested to know whether with post-COVID or long COVID patients that you might have come across, do they tend to be more mouth breathers, or do mouth breathers seem to be more affected by COVID at all?
It's a very interesting question. I haven't seen an association between mouth breathing and causing long COVID. But what I have tended to see was that the individuals who were more prone to long COVID were already in a stress response. And we have to ask the question, did they give themselves enough time for recovery post-infection? Or did they launch straight back into a very strenuous work and living lifestyle? Long COVID, nobody really knows what's going on there. It's certainly dysregulation of the autonomic nervous system. There's a lot of symptoms that are in parallel to chronic fatigue syndrome. But I've seen people who are much worse than anybody that I've seen with chronic fatigue syndrome over the years. We typically start off with exercise helping to stimulate the vagus nerve. And humming can be quite a useful one to help stimulate the vagus nerve. But some of these people don't have enough breath to speak a sentence. And they can also have postural orthostatic tachycardia syndrome. If they sit up or if they stand up, their heart rate elevates to 130 or 140 beats per minute. So we normally start them off with measuring their BOLT score, because that will give me some idea of where they are in terms of breathing. And I've seen BOLT scores as low as 3 and 4 seconds. So for those people who are not aware of what the BOLT score is, the BOLT score is you're typically taking a normal breath. I'll just clean this screen here. So you're taking a normal breath in and out through your nose, and you're pinching your nose with your fingers, and you're timing it in seconds. How long does it take until you feel the first definite desire to breathe? And then you should have normal breathing at the end. Now, can you imagine somebody with such labored breathing? They're breathing fast and they're breathing shallow. They're sighing, they're feeling air hunger, and their BOLT score is 3 to 4 seconds. Now, slow breathing is not going to help this person because they're already feeling suffocated. So this is when we do the breathing recovery. We have them breathe in, breathe out, and hold the nose for about 2 to 3 seconds. And then breathe normally down for maybe 15, 20 seconds. And then breathe in, breathe out, and hold the nose for 2 to 3 seconds. And the thing about long COVID is that when the autonomic nervous system is already taxed, we have to go very gently, because if we do too much exercises, it will throw the person back into symptoms again. So the rule of thumb is only to do breathing exercises, but don't overdo it. But I mean, my point here is that you should feel that you're able to do the entire cycle of breathing exercises again. I put a video out there when long COVID hit the scene in March of 2020, and it was one of these videos that everything went wrong. My laptop wasn't plugged in. I only noticed it when I went live. The lighting is wrong. I got nervous then beforehand, and normally I don't. It never seemed to bother me. You know, talks like this, I've been doing it for 20 years. Everything went wrong. Put the video up on YouTube, and it's had over 1 million hits,
Oh,
1
wow.
million views. And then we put up a video then with long COVID with all of the exercises. Because even when we weren't so sure of COVID, drawing on the experience of working with asthma, bronchiectasis, COPD, etc., and we knew that COVID was affecting in some way the respiratory system, why not teach people how to be able to have some control?
Mm.
And then there was an article that was written called, it was written in Microbes and Infection in May of 2020. Could nasal nitric oxide help to mitigate the severity of COVID-19? And, you know, this was never put out there. But inhalation of nitric oxide gas is currently being investigated as a preventative measurement and treatment against COVID-19. And there were quite a number of clinical trials that were taking place, but our nose also produces its own nitric oxide. So by breathing through the nose, you've got the filtering and humidifying and warming effects, but you also harness nasal nitric oxide, which helps with cilia movement, mucus production, antimicrobial effects, vasodilation, blood vessels dilate, bronchodilation, the airways dilate. And this could help to reduce SARS-CoV viral load. And the researchers, interestingly enough as well, they said that anecdotal evidence. So obviously the researchers in this instance, they were familiar with mouth taping because they said our anecdotal observations also suggest that favoring nasal breathing during sleep by sealing the mouth with adhesive. Now, we were using medical grade tape. You never, as the point is, and also I would say don't cover the lips. First establish that you can nose breathe during the day. You know, and at least if you have a tape that's surrounding the mouth, you know, you can open your mouth if you need to. But the objective is to try and encourage you to breathe in and out through the nose. But this would help to increase nasal nitric oxide levels in the airway, which may help to decrease viral load during sleep and allow the immune system more time to mount an effective antiviral response. So for COVID, yeah, we've put up all of the exercises for free up there. They're all up on YouTube. And they're there. And even people with long COVID, and I would say if you do have long COVID, it's a tough condition. And give yourself about 6 months. It doesn't go in a straight line. You're going to have ups and downs, and go very, very gently, because whatever it is, it's about helping to bring the autonomic nervous system into balance. Relaxation, guided meditation, very slow breathing, light breathing, nose breathing, body massage, anything that you can be helping to do to help halotherapy, anything that you can be doing to help make breathing easier should be used.
Fantastic. So really the nose is your first line of defense also. So if you are going out and about, breathe through your nose and it will act as a filter.
Yes. And you know, you're going for a walk with your mouth open, slow down your walk, close your mouth, and only walk as fast as you can while maintaining nasal breathing. Allow your nose to determine the intensity of your physical movement, and think of the benefits of it. Your mouth does nothing when it comes to breathing.
Brilliant. Well, thank you so much, Patrick, for this session today. It's really clear that your passion has become your purpose, which has now become your profession.
Yes.
And it's great that we can all benefit from it. And I'm very excited to hear what's in the pipeline with new things up and coming with your books or other things.
Yeah, we've got a couple of projects. So I'm writing a book, Breathing for Yoga, and writing it with a yoga instructor, because I feel that yoga breathing has kind of lost, I don't want to be critical or anything like that, but I feel that there's a massive and enormous potential in the yoga community, that if a yoga instructor knows breathing from a number of different dimensions, what they could do for their clients and students would be unbelievable. So that's the motive there. We're also developing a new app, which is due out at the end of October 2022. It's going to have 130 different videos. We put a lot of work into it. I put in about $150,000 into it, which kind of gives you an insight into, you know, the quality that we're trying to achieve with this app. But the app is going to be for free. Now, people in the business world are telling me I'm absolutely nuts sometimes you just have to go with a gut instinct. It feels the right thing to do, but I don't know logically if it is or not, but let's go and see. So I know anyway after about 6 months or so. I think breathing needs to get out there, Erin. It's been held back for so many decades, you know, and the full potential of breathing hasn't been that people, it's not in people's at the moment, consciousness. It's, you know, breathing is not about taking this deep breath, or breathing is not about just filling your lungs full of air, you know, like somebody with anxiety, telling them to go and take a few deep breaths for yourself could be the worst thing ever you tell them. We have to go beyond that, and we have to look at breathing. It's more complex, it's multidimensional, but it's simple at the same time. That's the way it is.
It's simple and it's free.
Yes, that's it. And that's held it back.
Fantastic. Well, thank you so much. That's brilliant.
Great. Thanks very much, Erin.
So that